I'm going to get started. Hi, everybody. My name is Ahava Leibtag. I'm the CEO of Aha Media Group. It's really great to have you all here. So let's get into it because building a sustainable content marketing strategy in 2025 seems to be becoming more and more challenging. So let's begin and let's see what we can learn together. So let's talk about the major changes that you are facing. Certainly AI and search is top of everybody's mind. I think AI feels like a foundational change to human life in general, not just to marketers who are responsible for fun things like SEO. There are massive regulatory changes happening. I think if you follow the news, you're probably as confused as I am, but every day seems to be a new change at a health agency, firing vaccine people, hiring vaccine people, regulatory changes to Medicare. So there's a lot happening in the mix, and that's obviously going to affect healthcare marketers as well. And then, of course, the top of the funnel shrink, which we will discuss. So this is what it used to look like, right? You type something in, you had a lot of great links, you could scan through them, figure out which was the right one for you, and then read it. Now it looks like this. So they have pulled the top of the funnel content up onto the screen so that people are getting quick answers to their questions. And so what that means is that your content is kind of everywhere, right? Search is happening in multiple places. We track our inbound leads and how people find us. Most of them are telling us that they're not coming through search. They are coming through ChatGPT. So they're going into their LLMs and they're asking them, who's the best healthcare content marketing firm? And they're getting us to pop up. So what that's telling us is that your content is everywhere, particularly if you're looking at the younger generation. We know that they are searching on their social media platforms. Something really scary just came out in the last 2 days. 50% of behavioral health information in TikTok videos is either incorrect or not based on evidence-based science. So we're looking at a generation of people who are changing the way that they search and the way that they find information. Then we're looking at AI use in healthcare marketing. So when we look at whether or not people are using this information, about 36% of surveyed hospitals are currently using generative AI for social media functions. Now, I can tell you that I should have had a date on this. This study is about a year old. So I bet you that number has increased tremendously. This is from 2024, so it's not that long ago, and 62% of consumers say they are less likely to engage with and trust content if they know it was created by an AI application. So that's 18 months ago. If anything, I think it's gotten worse. I think people are starting to really feel nervous about AI and the fact that it could create misinformation. Certainly, we know that it's created misinformation in legal briefs. It's hallucinated when giving people quick answers to questions like, should I jump off the Golden Gate Bridge, which is very, very dangerous and scary. And then, of course, the reality. So the real issue and the real understanding of the technology is that the large language models were trained on the internet. And that's a finite set of information, right? As huge as it is, and as a person could never go through all that information, these machines were trained on what's on the internet right now. So if something changes in science or healthcare, the only way for these LLMs to know about it is for us to publish content about it and tell them about it. So what you're basically doing anytime you use a large language model to get an answer to a question or to do some research is it is translating and interpreting what it knows already and just spitting it out to you in a regurgitated form. And that's why human content is still so incredibly valuable and important, because that's how we get new information out there. And that's also how we get our point of view out there. And that's how we make sure that it doesn't sound the same as everybody else. We've done a lot of recruiting at Aha Media Group over the last couple of months. And what we have found is that if it says furthermore in the fourth paragraph, it's generated by AI. I know the M- has gotten a lot of bad play as well. So the AI thing is definitely an issue. And we're going to talk about that and how you can tackle that as well. But what it really means is that there's been a massive top of the funnel shrink. So our strategy used to be that people would come in and ask what's supraventricular tachycardia, and we would be able to tell them on a page that they would then come to read about what supraventricular tachycardia was, and then hopefully follow a call to action to make an appointment with one of our cardiologists. Now, the answer to that question is right there. And if I would have hit this and expanded more, I would have learned even more about it. And also you can see here, it's here. And I'm a United States researcher, and it's still pulling stuff from the United Kingdom. So this is clearly, although you see Mayo up here, and this is probably from Mayo as well. So what you're seeing is that the way we used to pull people in from the search magnets and into our funnel isn't really going to work anymore. The other issue is that with the potential regulatory changes, it's certainly been made clear by the Secretary of Health and Human Services that chronic disease, nutrition, the way that people live their lives needs to be prioritized over specialty care. Now, for hospitals and healthcare marketers, that's a big concern because the majority of revenue does come from quaternary and tertiary care. You want primary care there, but that primary care is designed to lead to downstream revenue so that they stay within the system that you're working for. Then there's also going to be a change to reimbursement models if that happens. Now, it's hard to know what's going to happen with this, but it definitely is something that people are thinking about a lot. So if you want to drop off now and you just want the answer to all your questions, what you want to do is you want to focus on email. You want to get this channel right in 2025. It's really going to mean a lot to you. Repurpose your email content. Send it out to your subscribers. If you want to make it exclusive, you can make it exclusive to them for a short amount of time, and then figure out a way to repurpose it so that you can use it on published blogs and articles. But it's important for you to make sure your tech stack is working for your email. So make sure you're working closely with your IT departments on that. You want to make sure that your content is stellar. And we have a tip sheet for you at the end of this webinar that we'll post in the chat, and you'll be able to get a link to where you can learn more about what you should be thinking about with email in 2025. And then you really should be thinking about that distribution strategy, how you're creating a nurture campaign, drip campaign, so on and so forth. So that is, to me, the most important thing that you should be thinking about when it comes to 2025 and creating the anchor part of your content marketing strategy. So I just wanted to give you that up front, the executive summary. All right, let's get into why healthcare content is so complicated and why some of us may feel like we're still banging our heads against the wall when it comes to making sure that we publish up-to-date, real information that is digestible for our audiences to hear it. So this is a study that was from the National Center for Education Statistics. This is a study that was done a while ago. 9 out of 10 adults have difficulty using health information that is routinely available. I don't know, with all of the work that we've done in our world to try to make things into more plain language, if that's gotten easier, but we do know that literacy rates are dropping across the United States, unfortunately, as we teach our children to communicate with emojis. So we all have to be very vigilant about the fact that these are complex pieces of information and they are hard for the average layperson to understand. Top of that is that there is a major concern when you're faced with a healthcare crisis. Even a question about why am I having pain on my right side? Is it appendicitis? Can lead somebody's brain to start to get really, really nervous. And the amygdala, which is the middle part of your brain that's designed for your flight or fight response, is where this potential risk gets triggered in your brain. And so unfortunately, when you're faced with something scary, what happens is that you leave your frontal cortex, which is where your executive higher functioning happens, and you can sort of sort through information, and you get really scared and nervous, and you start to think to yourself, oh my gosh, what am I going to do? Do I have appendicitis? Is it something more serious? Is it something less serious? Do I go to the doctor? And all of a sudden you're spinning and you're not able to really think clearly and empathetically. So I have a story about this that I share with people. She's now 20. Her name is Amaya. And when she was 12 years old, she came to me and she showed me a rash on her legs. And the rash looked little red pinpricks. I'd never seen a rash like that before, but it also had rough skin on top. So I said to her, I think you just have dry skin. And I think if you put lotion on it, you'll feel better. About a week later, she came back to me and she's like, it's still there. And it had also gotten bigger. So I said to her, okay, I took a picture of it and I sent it to my friend Jenny, who's a pediatrician. And the last thing you want when you have a friend who's a pediatrician and you send them the picture is for them to respond as quickly as Jenny did. My phone rang and she said to me, how long has she had that rash? And I said, I don't know. She showed it to me like a week ago. She said she's had it for a little while. And then because I'm a medical writer and I've written about so many things that can go wrong, Jenny actually started doing the differential diagnosis for childhood leukemia with me. So are her gums bleeding? Does she seem tired? Does she seem sick? Does she have black and blue marks all over her body? Yes, yes, yes. So obviously I left my frontal cortex at that point and I was really, really scared. However, I was still kind of dumb because I said to Jenny's like, she needs a blood test immediately. And I'm like, do I have to go tomorrow? What do I do? Jenny's like, you're lucky I'm not sending you tonight. So it just goes to show that when we're scared, sometimes obvious things that we would know how to do, our brains just really shut down. Anyway, took Amaya in, got the blood test. It turned out that she had a blood disorder called ITP, which stands for idiopathic thrombocytopenia. It means that her body attacked her platelets and she didn't have enough clotting within her blood cells in order to stop a bleed. Obviously, that's a major concern, not just with an external cut, but also she falls down. She was an active 12-year-old. She really could have hurt herself and then have internal bleeding. And we ended up taking her to Children's National in DC, which I'm really so thankful to them because she did see a really wonderful hematologist there who prescribed something called IVIG, which is a chemotherapeutic agent that she took twice. And then she went on meds and then she was cured. She's in remission now. But I will tell you that anytime she has any kind of rash, because it looks like a heat rash, I freak out. And she's like, it's fine, mommy, don't worry. I was out in the hot today. But anyway, that story, I think, really shows that even me, who had all of this information about these things and really knows about IVIG and about ITP, I've written about it myself, really felt completely overwhelmed by this information. And in talking to all of you and in hearing your stories, I think a lot of us, even though we deal with this stuff every single day, when it's us and it's happening to us, it's way scarier and really affects our ability to comprehend what's going on. So that's why it's so important for us to have empathy when we're approaching healthcare content. It really does change the nature of the interaction for the person reading, consuming, interacting with that content. So how do we develop empathy for people? There's two different ways to look at this. The first is that empathy is actually really being able to understand and experience what somebody else is going through. And sympathy is feeling bad for somebody that they're going through it. And so the researchers at the Yale Childhood Study Center, which is the premier child study center in the world, or in the country at least, they wanted to understand when children develop empathy. Are you born with it? Do you develop it later in your life? So they did a study looking at the way 6-month-old babies reacted to a puppet show in order to see if they had empathy. Go ahead and you'll watch the video and you'll see.
One puppet tries but fails to get to the top of the hill, sort of struggling and falling back down. On alternating trials, we show instance one character who comes and bumps the climbing character up the hill, and down goes the curtain. If you're ready, up goes the curtain. On another trial, we have a character who comes and bumps the character down the hill. Down goes the curtain. And up goes the curtain. Infants see that interaction sort of over and over again between 6 and 14 times. After they're sort of finished looking at it and they're nice and bored, we simply ask them to choose between the two characters. All right, great. So we are all done with that part. We're just going to have our choose between the puppets now. That one. All right, good job. That was the helpful guy, wasn't it? But astonishingly, really, we are finding that upwards of 80% of babies are choosing the character who was helpful over the character who was unhelpful.
So we see that people really are born with a certain amount of empathy, and they are able to show that empathy to people, or they are able to feel for other people. And the fact that these children, 80% of them chose the yellow triangle, which I guess means 20% of the babies were psychopaths, but whatever, I guess you could track them and find out how they did later on in life. But you want to be the yellow triangle. When you're creating healthcare content, you really want to think about helping people, giving them that empathy that they need and that hope that they need to get through what they're going through. So let's talk about how one of the ways that we can demonstrate empathy for the people that we're creating content for, and that's through plain language. And unfortunately, plain language has gotten a bad rep. People think, oh, plain language, that means you're dumbing it down. But it's really not. It's really a very simple 3-part formula. You want to help people find what they need And that fits in really well with search. It's using words that they understand, especially in today's world with AI. I'm going to get to this later. Really using semantic clauses that people would use, language around what does it feel like to have appendicitis might be a question that people would ask instead of risks of appendicitis or pain of appendicitis or that kind of thing. It's also helping them understand what they find. So really breaking it down. Some of the best content creators that we have at Aha Media Group used to be teachers. And it's really thinking about how to demonstrate the information to people in a way that makes it easy for them to understand. And it sort of slows down that scary part. Somebody just asked me a question about reading levels. I'm so glad you did. I'm going to get to that in 1 second. And use what they find to decide how to move forward. So we want to keep moving people through the content until we get them to the call to action that they want. Okay, so the unfortunate truth about reading levels is that when that research was first done, there's a theory about that research that it wasn't really done that well, and it's a little bit faulty. The other thing to remember is that literacy levels have changed tremendously over years, and it's hard to really know where people are in the literacy scale. Also, think about where people are educated. A sixth grader in one part of Maryland might have higher literacy than a sixth grader in another part of Maryland, based on all kinds of socioeconomic and psychographic factors. So because of that, I don't really particularly love reading levels. However, when you're dealing in a world where people are looking for some sort of way to measure the readability of content, they can be helpful in terms of making sure that you're trying to hit a certain range. I really love Hemingway. I also love some of the built-in things that Word might have or Google Docs, where it might say to you, like, you could reword this or you could change this or this isn't clear. But the reason that I love the Hemingway app so much is that it will show you where the passive voice is. It will show you it will highlight for you exactly where the problems with the content are. And I think going in and solving those is far more appropriate than using reading levels to track. The other thing I always tell writers is read your content out loud, because nothing will help you see if it's plain more than reading it out loud and seeing how it's going to sound to the reader in their head. So I think that those are all more useful ways than using reading levels. However, I do understand that sometimes stakeholders or executives have made this like blanket statement. The New York Times claims that it writes at a 4th grade reading level. I don't know when the last time you read the New York Times was, but it ain't true. Okay, so this is how we used to write web pages, and we can still write them this way. There's nothing wrong with this. Key facts about it, symptoms, causes, triggers, that kind of thing. But now with ChatGPT and all the other LLMs, and I'll probably just say ChatGPT the way when I say search engine, I'm talking about Google. We're thinking about the way people are actually going to ask that question. And almost one of the ways that I think about doing it is that if you look at your headings or your H2s and they're written a certain way, think about how a patient might converse with a doctor. Like, what happens to my heart when I have supraventricular tachycardia, which is referred to as SVT? What are the different types of SVT? Which one do I have? How do I know? That kind of thing. So thinking about writing and creating content in a way that people actually speak or ask questions rather than just statements of fact. And as you can see, we really want to also help people understand. So how do you define it? A fast heartbeat or tachycardia can occur due to various reasons. And that's not plain language. It's just reasons, right? You don't need various, including exercise, stress, anxiety, caffeine, or I don't know how I feel about underlying, maybe not. You could just say other medical conditions like an overactive thyroid or heart disease. And then you'd have to explain what an overactive thyroid is later. But you can see here at the University of Utah Health, which happens to be a client of ours, just full disclosure, they do this so well. Why is my heart beating so fast? That's really what people are asking for, because before they get the diagnosis of SVT, they may not know what it is. And so by saying to them, giving them clues by the way that they're feeling, you're going to have a better chance of them finding you, both through search and through a ChatGPT. The other issue now is that people are really going to go into the LLMs and ask them to solve multi-step problems for them. So it used to be, or Google AI mode, it used to be that you would, what's wrong with me? And you would try to figure that out. Then you would try to figure out, okay, do I have a doctor close to me? Now people might go in and they might say, why is my heart beating so fast? And who's the best doctor to treat that? And make sure that they have an office within 10 miles of my house. And then it becomes a whole different kind of search. So we really have to think about layering all of our content on top of each other to make sure that people find exactly what it is that they're looking for, and thinking about the fact that they're going to ask the LLMs to really give them that information in a way that kind of does all their research for them in one query, instead of having to do a multi-step process through Google. You knew that I wasn't going to give a workshop without some sort of reference to Taylor, right? She had to be here. So there's a lot to learn, right? And it means that clarity is a competitive advantage. So the number one thing to think about when you're creating healthcare content is that you want to be as clear as possible. And that is really taking us now, because we've laid that foundation, into some of the things that I think you can do to make sure that your content strategy is competitive for 2025 and beyond. So the first thing we need to do is understand our audience. The next thing to do is to define goals and priorities. The third is content reuse and distribution. And the fourth is changes in search. Now, I just want to be clear. I don't think anything that I'm telling you here is earth-shattering or different than anything you've seen before. My goal in this workshop is to get you to look at things a little bit differently and maybe supply some nuance and thought where before we might have been a little bit more straightforward, and taking into account all the changes to search and AI that have happened that really need to influence maybe even some of the foundational things we thought about content marketing before. And so from an understand your audience perspective, I want to take you through 2 case studies that we did at Ahava Media Group. Now, I want to be very clear about this. This is not a dog and pony show. This is not a long commercial for Ahava Media Group. That's not my goal here at all. What I do have here is 2 case studies that have very clear results at the end of them. The data is there to show that the process was successful and that we were able to get the client closer to what they wanted their business goal to achieve. And that's why I want to tell you these 2 stories, because I think if you see the way that we approach the issues and how we solve them, it will help you in your own practice as well. Let me go through the NeuroPace one. What happened with NeuroPace is they came to us and they said, something's wrong with our content. We just don't know what it is. We are creating so much of it. We have ambassadors. We feel like we understand our audience. We're not winning on our SEO play. Can you help us try to figure it out? And a little bit about NeuroPace. NeuroPace is a medical device that's implanted in the brain that monitors and controls epileptic seizures. But you can't really get insurance for that, or insurance approval for that, until you prove that you've had drug-resistant epilepsy for 20 years. It's an extremely long journey for patients to be able to get that. And we did an audit on their content. We spoke to their stakeholders. We looked at their SEO, and we found out some really important things. The first is that even though they thought they understood their patient, they weren't talking to them at the right time in their journey. They needed to be talking to them earlier than when they got to the end of the 20 years. The second thing is that people didn't understand the device or what it would give to them. And by the time somebody's had drug-resistant epilepsy for 20 years, usually there are caretakers highly involved in their lives. And those caretakers need to be part of those conversations. But you want to get the patient before they're at the point where they may not be able to make those kind of decisions for themselves, and they're going to need the help of somebody else. And then the third thing were that their community and their ambassadors were the core strength of the brand. And that was how they were going to be able to get that information out there. I cannot tell you how many times when people come to us and say our content isn't working well, what we find is that there's a genuine misunderstanding, not only of the audience, but who affects the audience and their thought processes. And that's one of the reasons that we talk about co-personas so often. Very often, the people that you're creating content for are not making these decisions on their own. I'll give you an example from my own life. I'm right in the sandwich generation, right? Not a fun place to be. I have elderly parents. My mom just had a cancer journey. My dad has heart failure. I have 3 children. I have a husband. Myself, I have to take care of my middle-aged body. And there's a lot going on in my life. And so when I'm consuming healthcare content, I might be consuming it for my parents, for my children, for my husband, for myself. And so if it's written from the perspective of only the person experiencing what's going on, you're missing out on the decision-making part of the audience. So that's a really important part to think about. And even if you think you know your audience really well, double check, triple check, hang out in waiting rooms, talk to doctors, talk to nurses. They'll tell you a ton about what's going on for patients and their caregivers. Really important to make sure that you're really getting at your audience, not only the right audience, but the people who affect their decision-making, and then at the right time in their journey. And so what we found was that NeuroPace really had to change when they were talking to people and the people that they were actually talking to. So they weren't getting in front of the doctors who could start talking to the patients about this journey earlier. They never sat down with epileptologists, who are the only people who can sort of prescribe this device. And they didn't sit down with them and say to them, you should start talking to your patients about year 15. They waited until year 20, and that was already a problem. So by engaging the ambassadors of the brand to start talking to doctors to tell them you need to tell patients sooner, it really helped them to be able to resegment the way that they were talking to the patients and the doctors, and the ability to really get in front of them and make sure that they understood what they needed to do. Last one, it was a physician-led journey. Now it's a patient-led journey. So we're thinking about both ways that this could potentially go. And when you look at it, you can see that it's a different journey, different order about the way that somebody might think about this. So what we really had to do was we really had to educate both the doctors and the patients about the information, about what they needed to do, about what the journey was like. And that was really important to understand. You use personas because it gets you all on the same page. It helps you to understand where they're coming from, what their questions might be, and they can feel like a real person. And so it was really for us about thinking about how to build a different kind of funnel. So you may need to build a different kind of funnel for your patients based on all these changes that are happening within the space, both regulatory, AI, that kind of thing, but also really getting to know your patients and understanding when they do respond to content and what's important to them about it. So we built a persona based on everything that we learned. And here you can see it's the classic persona, right? You just see everything that you would see on a persona, what the triggering event was, what their past experiences are, how they're feeling right now, where they are in the funnel. That's really important to put on a persona, where they're looking for information so you can be in the right place, who they listen to, and then where they hang out on social media. But it's the second part of a persona, the content journey, that I think is so critical. And I don't necessarily think that you need to spend all the time we spent researching this. You can build pretty great personas using a combination of data you already have. And then think about, if you want to put them into that funnel consideration, think about what would their questions be at every part of this journey. And then taking those questions and turning them into that semantic content that AI overviews either may surface for them, or that they're going to continue to go deeper. Now, one of the really good pieces of news about these AI overviews is that if people scroll below the fold and they do come to your pages, they seem to be much more highly qualified. So it suggests that they're doing their research on Google itself or in an LLM itself, and then seeking you out because they've decided that you're who they want to go see. So here you can see the persona in a little bit more, you can see it bigger here. And if you want to watch this video again, you can take a look at what they're like. We also have a ton of articles on personas on our blog. I think we even have a downloadable persona template that you can get off one of those articles. And I think that you can see how that works. So the other major thing that I don't have a slide on, but what I want to tell you is that in learning about their personas and in understanding who they were really trying to target, when we did the research, we found that they were trying to own the keyword epilepsy. But they don't treat people with epilepsy. They treat people with drug-resistant epilepsy. And so we really refined their SEO strategy to target those patients and those doctors that treat drug-resistant epilepsy, rather than just epilepsy as a keyword on its own. Like, could you imagine trying to own that word? It's maybe the National Epilepsy Foundation's got it. Everybody else is going to compete. So this resulted, these changes that we did in changing who the personas were, when in the conversation we were targeting them, and getting the core ambassadors of the brand to talk to doctors and patients about what NeuroPace could do for them earlier in the journey, resulted in a 64% increase in inbound leads. And in this case, inbound leads refers to physician referrals, which is really the most important thing, because once the physicians refer, then you start the whole process of making sure that the patient is going to get the device. So I think that's, to me, like a really great example of, you think you know who your audience is, but double check, triple check, make sure that you're right about it, because especially in a complex quaternary care situation like this, and we all know that you're getting pressure to bring in more of those types of patients, especially in the right commercially insured mix, you want to make sure that you truly understand who the patients are and what their concerns are at every different part of the situation. So I'll give you another example of my own life recently. My mom went to Moffitt Cancer Center in Tampa, and I was going to stay with her for the 5 days that she was in the hospital. And they had information about what the patient rooms looked like. And that was really helpful for me because I was able to see the couch bed. I was able to see that I would be able to stay there with her comfortably. I got a really good sense of what it was like. But the one thing I really wanted to know was, is there a refrigerator in the room? That was something I needed to know for the way our food situation was going to work. And it didn't say that. And they happen to have on every floor 2 kitchenettes where they serve coffee and they have ice cream stocking the refrigerator, the freezer. It's a great setup. It wasn't mentioned there. So I had this whole thing where I was like, should I rent a refrigerator? Can I even bring one into a hospital room? Is that going to be an electrical issue? And I think that that's a really good example of, she was already going to get surgery there. It wasn't going to change our decision, but that small, tiny piece of information would have alleviated some concern for me. So it's really spending time with patients and talking to them about the types of content that they want that really help you deliver those kind of digital experiences that make the difference. Okay, that's one case study. I'm going to go through another case study and then we'll break for that 5-minute break. I just want to give a trigger warning. This case study is about sex addiction. So if anybody feels uncomfortable about that, you certainly can mute, take yourself offline. I'll probably finish up in about 5 to 7 minutes and then we'll take a 5-minute break. But I do always like to be very respectful of the fact that could definitely trigger people. Okay, so the question for this one, and this is really around, bulk of this conversation is around, are we using the right terms that people really search for? And I think that a lot of us have fallen into the trap of thinking, well, if I do the SEMrush research and I do the Google Trends research and I look at the people also ask, I really have a good sense. But what this case study shows is that unless you actually speak directly to stakeholders and patients, you do not really know how people are going to search for things. And it's really important to have that one-on-one conversation to try to understand how people search for things. So the Keystone Center is a sex addiction treatment for men. It is a 16-bed inpatient treatment facility outside of Philadelphia, and their average census with how many people are in the facility is 7 to 8 patients at a time. So obviously they came to us from a business perspective as, how do we get more patients within our facility? And how do we help more people? Some of the things to know, though, is that sex addiction is, in the full spectrum of addictions, somewhat rare. It affects less than 10% of the population. People feel, I'm just going to speak about men here because this was a men addiction treatment center. Men feel a tremendous amount of shame about this, which doesn't always lead them to reach out to get help. And practitioners who refer, like psychiatrists and psychologists, find it very hard to find evidence-based care for their patients. They don't want to send them to a quack rehabilitation center for sex addiction. They want to make sure that they're going to a place where they're really getting really fantastic care. And so I just want to show you the results up front so you see what we were able to do. And then I'm going to describe what the content process was that allowed us to get these results. So we saw 111% increase in traffic, 105% increase in sessions, a 57% increase in phone calls, which is huge, and a 37% increase in admissions. So we're really proud of the work that we did here, because not only did we solve a business problem, but more people were able to get help for something that's obviously a very, very painful condition. So we interviewed 2 stakeholders for this project that speak directly to this keyword part of it. One was a business stakeholder who really focused on the differentiators that the addiction center had from other competing addiction centers. But the second stakeholder was a clinician. And you're going to see, I'm going to show a video of my writer, Emily, talking about how she did this research. But this second clinician really opened, I remember when I interviewed Emily for this, my eyes were totally open to how I needed to rethink about how I did keyword research. Because she explains that he really got into the true meaning of what sex addiction is. The empathy part was huge here, right? You really don't want to make people feel judged or shamed. You want them to know that there's help available for them. And when she delved, you're going to see Emily describe, so I'm not going to talk about it anymore. I'm just going to show her. the way she did her research and the way she was able to take what he was telling her about how patients talked about their issues and braid it into the content really made a huge difference. Let me show you. This is me interviewing Emily about how she wrote about this particular treatment center.
So basically, he kind of emphasized that these conditions affect people in a very specific individual way. When we talk about it with a lot of other healthcare content, when we're talking about the personalization and the kind of individualized approach, that's where he was getting into. Because someone may think, they may think of the term, the diagnosis, porn addiction. I don't have an addiction to porn. But he said it can take many different forms. So for instance, it could, I jotted a few down. He said it could be something just like someone can't get an erection without watching porn. It's not so much that the person watches porn 24/7, it's that it can take this other form. And so he kind of listed a lot of those in great detail for me during the call, which was mildly uncomfortable. And I had to figure out in the content, because obviously I wanted to work those kind of examples into the content. And so there was this, I had to thread the needle between giving these specific examples so someone on the porn addiction page could be like, oh, I do that.
And that's really important for keyword research, because the more specific you can get, the better keywords are going to be. And then the better the people that really need the help are going to find it.
Yeah. And so the more specific he got, and I really, on the pages, I really kind of listed those specific scenarios and I bulleted them out. Like someone may only have an intimate relationship with a prostitute, or they may only engage in sexual activity in an anonymous chat room. So I had to get very specific to make sure that we were reaching all the different manifestations that these behavioral health problems could have, so that people could make that connection to what they were going through.
This is a really great point about how the more you know about the audience, the better off you are in terms of the value of the content that you're going to supply to people. So you heard her say, as a writer, I would have probably just gone into it doing the same thing, porn addiction, sex addiction, relationship addiction. But as she pointed out, people don't think of themselves necessarily as addicted. It's just behaviors that they may think of their own idiosyncrasies when it comes to their attitudes towards their sexual behavior. So she changed it and really flipped it to this much more specific way of trying to educate people about, if you're always watching online sex, if you're scared of sex, if you have a fear of emotional intimacy, then these might be things that signs to you that you may need to get some more help around these issues. So you can just see one of the stakeholders said, we have 2 more admits in the next few days. We have not had a census of 7 or higher in over 2 years. So the SEO clearly worked, but I think also bringing that empathy and that education to the content and really showing that was an evidence-based center really helped them with both their referrals and then those people who self-referred into the center. Defining goals and priorities. So this seems like the most basic part of what we do when we talk about content strategy. And yet I often find that with the kind of stakeholders that most of us are dealing with on a regular basis, we do find that it can get pretty hairy when it comes to really helping them understand what we're trying to achieve. So content, and basically any marketing strategy, I think should come down to achieving business goals through helping users accomplish their tasks. And I think that when you boil it down to something as simple as this simple Venn diagram, that's where the magic needs to happen. And sometimes the business goals are not going to help users accomplish their tasks. They're just going to be business goals that have to be met in a different way. And sometimes user tasks are just tasks that need to be accomplished by the users. But the sweet spot really happens when you hit on both. So let's talk about how we think about content plans and building content plans. And very often when we talk to people, what we find is that sometimes a content plan is designed to make a stakeholder happy or an executive happy. I want to do a blog about X. I want us to do a video series for this reason. I want us to cover the news because I think it's going to get us more mentions. But when we dig into whether or not that's really possible, what we find is that it doesn't always work out that way. So what I suggest is thinking about what are my very clear business and marketing goals, and hammer those out with your managers and try to understand what they're trying to achieve. Then thinking about how the content marketing strategy is going to align with those business goals as well as what your audience wants. And then figuring out each of those marketing tactics that you're responsible for. So what is the website objective? Is the website's main objective to drive leads? Is it to get new patients, or is it to inform and educate every audience that we've got? And then if that's the case, how are we going to measure that? Because traffic is dropping because of AI overviews. And so there's got to be a lot more stakeholder education about how to measure things like that. What's our search objective? What are we trying to do with our search strategy? How are we trying to pull people in? What's going to happen now that things have changed? What is the goal of the blog? Who are we trying to create blogs for? How are we going to build a taxonomy that's going to make sure that they speak to our evergreen pages? How are we going to cross-reference them? How are we going to track if people are really using them? Are we going to put calls to actions in our blogs? What are we trying to accomplish on social media? And then you have to have a different business objective for each social media channel that you have. Is Instagram your internal audience? Is YouTube an educational? What are you doing on each of these channels and what's the goal? And then if you have a newsletter, again, thinking about that business objective. So always making sure that all of your tactics that are inside of your content marketing strategy are laddering up to the business strategy. So one of the best ways to do this is to have a content marketing mission statement or a core strategy statement. And the way you think of it is this: there are 4 different parts. What's the content product? Who's the audience? What are the user needs? And then what are the actual business goals? And this is the way that you actually write something like this. And this is an example from the Content Strategy Toolkit by Megan Casey. Business goal: to reduce customer service center costs. So let's turn this into a hospital. To reduce call center costs, the content product, we will provide user-facing, task-based support content. We will provide clear appointment and scheduling information for our patients and their caretakers. Who's the audience? The patients and their caretakers. And the user needs when they are calling to schedule an appointment or get further information about a physician. And that really gives you a very clear strategy statement about what you're trying to do with your content. So what ends up happening is that if somebody complains, well, I want the content about the call center to talk about, I don't know, what would you talk about with a call center? Something that doesn't have to do with the business strategy, you're able to reflect back on this business strategy and say, but that's not what we're creating content around the call center for. We're creating it very specifically for this particular reason. So in the workshop, I had this slide. When you have a chance to take this back to your desk and sort of think about, okay, what are the business goals? What are the content products that we produce? Who is the audience? And what are their needs? And I think you really do have to think about this almost for every channel a little bit differently. I think with social media, you can create one mission statement and then just sort of think about the different audiences that are each panel. So let's talk about brand pillars. I often find that people will come to us and I'll say they're talking about creating a content strategy or missing parts of their content strategy. And I ask them, what does your messaging architecture look like? And then I always say, what are the brand pillars that you go back to? And I think it's really important that when you're thinking about building your strategy and your priorities, you always want to make sure that that messaging is always laddering up to the actual brand pillars of the institution. I also think that when you document this stuff, you really need to show your content creators how to do that. So your style guide should say, if we talk about our brand as X, here are some good examples in our content of how we brought that to light. The second thing is, this is a way for you to differentiate yourself from the competition. If you go onto a lot of hospital sites or healthcare sites, it sounds like a sea of sameness, right? Like, we're focused on the patient and we care about you and we're research driven. And okay, those are great things to say, but everybody's into that. What makes you different? Give me actual facts I can sink my teeth into. We funded 43 research grants about breast cancer, which makes us the best breast cancer center. We replaced 1,000 joints over the last year, meaning that people have regained function in their lives and are able to enjoy themselves as much as possible. And then the other thing that brand pillars can do is they can really help you guide content creation decisions. Again, always tying it back to, does this really speak to our brand and what we really want to talk about them? So this is content pillars, right? This is, I think, where there's some confusion around this. Do content pillars match brand pillars exactly? And I don't know always that they should or do, because the brand can definitely stand for things that some of your audience don't care about. For example, somebody looking for a primary care physician doesn't care that you do research. Somebody who has metastatic cancer cares that you do research. So thinking about what the content pillars are that represent each of the content assets that you're producing can really help you distinguish the brand. So This is an example of where we created pillars for a med tech company, and we were talking about what exactly their pillars needed to be for their blog. And obviously, not every blog is about innovation and expertise, but the content pillars help you decide, okay, week 1, we're going to publish on innovation and expertise. Week 2, we're going to publish on value of partnership. Week 3, we're going to talk about product marketing, which is this 360-degree solution product they have. And then on the 4th week, we're going to publish about efficiency and sustainability. So really thinking about what are your editorial, you could almost think about them as editorial pillars as well, and not just content pillars. And then what you do is once you have those content pillars, you can start really thinking about, okay, well, what are we going to do? We're going to talk about inside of innovation and education, we're going to talk about moving healthcare forward. What's that topic going to be? Cancer research. How's it going to come across? As a news feature. It's going to feel investigative and like it's giving people new information. One of the content pillars is exceptional care. We're going to talk about insights in exceptional care. We're going to talk about value-based care, and we're going to do some thought leadership around it. So thinking about it from that perspective can really help you editorial plan out and really make sure that you're always laddering back to that strategy. Again, if anyone has any questions, please feel free to drop them in the chat. Happy to talk them through. Okay, ready to talk about content reuse and distribution? All right, let's do it. I don't want to spend a lot of time on this slide because it could get very boring very fast. But basically, I think that when you're thinking about owned media, earned media, and paid media, you want to think about some of the things that I have here in these bullets. Here's the one thing that I want to say. I just read an article from Content Marketing World yesterday. You can go on my LinkedIn and you can, I think the last thing I posted, getting back to what we're talking about right now, I think earned media is actually going to become more important with AI search overviews, because I feel like earned media wasn't as, it fell out of favor, or people wanted to create their own content through the democratization of content. But there was an interesting, it was from the Content Marketing Institute, and there was an interesting article, part of the article about how earned media and press mentions are going to be important. So I just think that's an important thing to think through. But I think that this is a good example of how you can create balance, you can create a good media mix by balancing owned, earned, and paid channels. Okay, let's talk about repurposing, because I talked to you in the very beginning and I said, get on your emails. Well, how do you repurpose that email? Okay, so let's say this isn't a blog article. Let's say this is an email, okay? And the way that you've decided your email strategy works is that you have different campaigns for different service lines, but you have one overall general newsletter that you send out to all your subscribers, or some segment of your subscribers that all belong into a different strategy. They're all part of the people you want to nurture, retain, whatever. So let's say you decide we're going to do a news article here, and we're going to make a news article a hero about something that just happened in healthcare that we know people are concerned about. Changes to the COVID vaccine recommendations. That's something that people want to hear from their provider about. What does this mean for me? Then you might want to do something else here, a recipe or a fun exercise tip or something like that, that you know your audience might be interested in. Maybe you want to talk about a physician spotlight or a patient story. And here you might do just like a list of current events that are happening at the hospital, support groups, things like that. If you're going to move that over to the Facebook post, then you can just take this picture that you have here and this article that you did, and you can just move it over to Facebook. And with a quick changing the way that you describe what it is, you now have the article there on Facebook, and you also have the description of what it is, and you don't have to rewrite it. You don't want to edit it and smooth it out for Facebook. And then if you wanted to just take out part of the article so that it's zero-click content, which means that, remember, social media channels are rewarding content that doesn't take you off the platform. So you could just put a picture of the patient, that relates to the news article. And then you can just put highlights from the news article on that zero-click piece of content. And then below in the comments, you can say, link to this article for more information. That's how you can repurpose your content without having to really write this or create the same thing 17,000 times. Here's an example that we use for our B2B clients. So let's say they do an ebook on autonomous coding in EMRs. Really interesting subject, right? But for people who have to worry about reimbursement claims being paid, that's really important stuff. So they might do an ebook about like what you need to know when selecting a vendor, or changes in coding or something like that, where they want to keep their audience abreast and informed. They can take that one big ebook and they can break it up into a lot of different parts and use those different parts for different content assets. Now, whether they use every single part to direct people back to the ebook is their choice on each of the things that they do. But again, going back to that, the personas of who they're talking to and what they care about and the social media channels that they're on, and then looking at the content pillars and the publishing calendar, it really can help you decide how you want to break apart that larger piece of information and use it in a lot of different ways. Here's a repurposing content plan example. So you can see, let's say you start publishing January 1. Remember January? It was so different back then. Here's the blog post. And then you might want to start, it's the allergy season, right? It starts in May. And this is a blog post about allergies. You may want to publish it in January, or you may want to publish it a little bit later. But you can start beginning to stagger your postings and not necessarily rewrite them so that you're getting in front of your audience. And by the time they actually get to allergy season, they're kind of ready to pay attention to this. They may have seen it all, but then think about it. When you first posted in, let's say, February, you could say getting ready for allergy season. And then when you post it again in May, you can just call it allergy season is here. Make sure you're ready. And that's how you can repurpose those things and make sure that you're getting ahead of what people are thinking about. This was something that I thought was really important in terms of repurposing content for socials. People are really, I said at the beginning of the presentation, people are really turning to social for healthcare decisions. So 41% of healthcare consumers use social media to decide on healthcare providers. I don't know about you, but I belong to a chat of women in my community, and I need a pediatric dentist. I need a joint person. My kid broke their arm. People are always looking for those kind of things. Now, that's not social. The example that I just gave, closed social, but certainly on Facebook, I always see people asking for recommendations for things. 40% of healthcare consumers use social media for healthcare information needs. My kids don't go to Google. They go to AI and ask it questions, and they go scarily to TikTok to get information. And there are sometimes my daughter will come to me and she'll say healthcare information like it's a piece of fact. I'm like, where exactly did you get that from? And she's like, from TikTok. And I'm like, girl, you're 22 years old and in college. Do you not have any critical thinking skills? Just because you saw a video on TikTok doesn't mean it's real. So I think it's really, really important that one of the things we have to do is educate our consumers about what's really true and what's not. Because if 90% of kids aged 18 to 24 trust what they see on social media, they're not getting great information. And we really have to be careful about that. Social media ranked 4th among sources Americans use to self-diagnose. Have you ever heard doctors complain about this? Oh my God, I roll my eyes when the person comes in with a stack of papers this high because they've printed everything out from the internet. So you see a lot of people use search engines to make these decisions. Then they look at WebMD and Healthline, and then 22 or 23% of them go to a hospital or health system's website to get information about what might be wrong with them. Obviously, social media is really, really important for business and marketing goals. We talked about it as a distribution channel. I think it's really important as part of your content marketing strategy. But like I said before, you really need to make sure that each of your channels, you've mapped out exactly who the audiences are, what you're producing for them on that channel, and also how you're not going to drive yourself crazy doing all of that distribution and not reinventing the wheel. This is OHSU. They're a really great example of how they repurpose content in a really fantastic way. So here's a newsletter or like a blog post that they wrote about, should I carry Narcan? This is a huge issue for them. They're in Ohio, big addicted population there. This is a constant medical emergency that they're dealing with. And then you can see how they took the picture from the blog post and they used that on their Facebook post. Then they did a 0-click piece of content on Facebook. And then this is probably, I cut this off of Instagram maybe, where they showed a picture. And then they also had a video of how you provide Narcan. It's very, very important. This is just a really nice piece that was done by UNC Health at Rockingham. They wanted to show myth versus fact about cholesterol. So this is a really nice piece that you can do for social media where you're giving people quick pieces of information up front that are correct. I really would have liked to have seen a call to action here. Like, why did they publish this about cholesterol? Maybe it's a part of their content strategy to educate people, but there's certainly an opportunity to push them into their funnel even more. This is an example of where you have a problem. You don't really want to put these links. You can still put links on Facebook. Obviously, that still works. And inside of X, certainly, God knows what's going to happen to X. But this is an example of where these kind of posts are not performing as well on Facebook anymore because they really want to keep people on the platform. They don't want them to go off, as I said before, So it's really important that you kind of try to give all the information. And if you do want to lead people places, put the links in the comments. Okay, how do you optimize your posts to make sure that they come through on SEO and also within the LLMs? Use keywords. And the great thing about social is that you can really be very conversational on social. So really think about those semantic searches. What does it feel like to have a heart beating fast? Not what is SVT? Don't make the product the hero, make the problem that they're having the hero, and that you're solving it with explaining to them what the issues are. Tweets and YouTube videos are indexed and appear in Google SERP. So is Reddit. So you want to watch that kind of stuff. Obviously, you want to make sure you're optimizing your YouTube videos, making sure that you're treating video titles like H1s, because that will help people find what the video is about. So don't call it like the poetic thing the doctor wanted to call it, what the piece of information is really about. And then make sure you put in local information, because that will help boost your local SEO. And that's going to become even more important, like we talked about when we said that the LLMs are going to do this multi-step research for people. And then here is an example of where you can see that Northwell Health is inside of Twitter. How old must this picture be that it actually says Twitter and not X? And you can see that when you Google certain things, they do pop up on the knowledge graph right there on Google. So they are experimenting constantly with the social posts that you put out and indexing those. Okay, we're going to talk a little bit more about changes in search, and then we'll wrap up. Again, we talked about this. Obviously, I typed in senior care for after hospitalization. The search labs gave me the AI overview about the different kinds of senior care that we could look at. And then there was obviously sponsored posts. I don't like to use a crystal ball and I don't like to predict the future, but I will tell you that I am 90% sure that the LLMs will monetize the content inside of them. And so you're just end up going to be spending money on ads within an LLM rather than ads on Google or ads within AI mode on Google. So I just think we're looking at that kind of thing eventually, where it's not just going to be sponsored posts, but they're actually going to say, to see one of our sponsors, hospital rooms, click here type of situation. Again, this is showing that they're trying to understand what I'm really looking for. What is the actual search intent that I might be interested in? And you can see that the AI answer box has the same information, but it's worded a little bit differently depending on who asks the query and when, trying to figure out what I want. You can see the ads that are commercial, and then you can see over here the answer and the link, which is like the classic way. So basically what they are doing is they're pulling out from the page itself, which is probably why they wanted the descriptor tag so badly, for us to start using that so they could start doing that on their own. Okay, so this is what I've been talking about the entire time, the traditional query versus the long tail query. Instead of people typing in flu, sometimes they're going to type in what are the first signs of the flu, or what are my first symptoms of the flu, pediatrician near me. Again, a multi-step process here that they're looking for from a search perspective. So again, your content has to be layered on your data. Best hospital for heart surgery, you can see, I don't think anyone will ever ask which hospital has the best success rate for heart surgeries, except for a heart surgeon who already knows that it's his hospital. But I do think that people are going to ask more specific questions. You know, who's the best doctor for heart surgery? People don't care if they don't know about the hospital itself. What foods should I eat to manage my diabetes? Urgent care wait times. How long are the urgent care center waits near me? People are going to ask that question. Imagine going into an LLM and getting that in real time without having to go look on every single urgent care's website. So if the top of the funnel is shrinking, which is the education part, what does that actually mean for you? And I think what it means for you is that you definitely want to still think about the fact that you're educating people on things, but you have to think about your blogs and your evergreen content pages as really giving people information with using long tail keywords. So, you know, the top part of the page where you talk with empathy about what they're dealing with and that kind of thing is important. And actually, Google may reward those pages and pull the AI search overviews from there. And obviously, you still want to have all of that content there, because when people actually land on the page to follow through on the call to action, you want to really have empathy and explain what's going on to them, as I said in the very beginning. But you want to answer people's questions as fast as possible. And you want to make sure that the way the questions are coded into your SEO and your schema markup, which we have a great video of that by Martha Van Berkel. about your schema are coded in a semantic way so that people really understand, so that the search engines and the LLMs understand that you're answering those questions. The mid-funnel consideration is really important. That's where people are comparing doctors, hospitals, research, treatments, that kind of thing. And then obviously you want to make sure that that bottom funnel conversion happens. One of the questions that we get a lot is when to use organic versus paid in healthcare marketing. So you can see here, these are the reasons that we think you should use organic. These are the reasons that we think when you should use paid. Obviously, when you're building long-term brand authority, educating on complex conditions, nurturing patient communities, establishing thought leadership, and creating patient resources should be organic. You might want to go paid if you're launching a new treatment and it's very competitive in your marketplace. You want to reach specific specialists. I think Doximity is very often used to do that. You need immediate visibility. That's when you're going to want to do paid. You want to promote time-sensitive content, and you want to drive specific conversion actions. And we talk about the best channels to use there for that. So I'm actually, believe it or not, we're almost done. I have a bunch of resources in here. You will get these slides, so you'll be able to click on these links and go to these resources. Here they are continued. So here you'll find the persona stuff. Here's the plain language stuff. We also have a really great AI ebook that we created. It's 9 pages on how to think about AI for search. So there's a lot of great links here.